continuing with the lower airway, and concluding with the other structures that support ventilation. Starting at the top of the respiratory system and working our way down, we first encounter the nasal cavity. The nasal cavity does more than just give us a pathway for air to enter the respiratory system. It also cleanses, warms, and humidifies our inhaled air. Just below the nasal cavity is our oral cavity, which contains the mouth, teeth, tongue, and jaw. In many instances, EMS providers must manipulate the mouth, jaw, and tongue to ensure a patent airway in an unconscious patient, so it is important to be familiar with the structures in the oral cavity. These structures, their significance, and their manipulation by the EMT will be discussed in greater depth during the module pertinent to airway management. The posterior of the airway in the head and neck is called the pharynx. The pharynx is divided into three separate areas. The nasal pharynx is located posterior to the nasal cavity. The oral pharynx is posterior to the oral cavity. Inferior to the oral pharynx is the laryngeal pharynx, which connects the airway to the larynx and the esophagus. The epiglottis lies superior to the larynx, anterior to the pharynx. It is a structure of elastic cartilage covered with a mucous membrane and is designed to cover the larynx when we swallow to protect the lower airway from foreign bodies, such as food or beverages. The last upper airway structure is the larynx. Commonly referred to as the voice box, the larynx contains the vocal cords and serves as a connecting structure between the pharynx and the trachea. Inferior to the larynx lies the lower airway and its structures. The first structure is the trachea, which is essentially the tube through which air passes from the upper airway down into the bronchi, where the air is then diverted to both the left and right lungs. The bronchi continue to branch off while diminishing in size to route the air throughout the entire lung. When the bronchi diminish in size to the point where they no longer contain cartilage or glands, they become bronchioles. At the end of the bronchioles are the alveoli. It is in the alveoli, these little sacs, that gas exchange actually occurs between the air and our bloodstream. In addition to the structures that comprise our upper and lower airways, there are other structures within our body that are essential to supporting ventilation. We have muscles that exist between our ribs. These muscles are called intercostal muscles. We also have a diaphragm, which is a large muscle that sits inferior to the lungs. These muscles work in conjunction with our chest wall to produce both positive and negative pressure in our lungs. When we need to breathe, it is the phrenic nerve that carries messages back and forth between the respiratory control center in the spinal cord and the diaphragm. Because our lungs need to expand and contract within the chest cavity, both the lungs and the chest cavity are covered with a membrane known as the pleura. Given the existence of pleural fluid between these two layers of membranes, the inner and outer pleura can glide effortlessly against each other, thus facilitating the mechanical process of breathing. Lastly, the respiratory system has to connect with the circulatory system at some point so that oxygen and carbon dioxide can be exchanged. This process occurs in the alveoli, which are covered by pulmonary capillaries. As you will find throughout the course, not all patients are the same. This is especially true when discussing the respiratory system of a pediatric patient. When managing the airway of a pediatric patient, it is important to recognize the following differences in the pediatric airway. Mouth and nose are smaller. The tongue is proportionally larger, taking up more relative space in the oral cavity. Trachea is narrower. Cricoid cartilage is less rigid and developed. Airway structures are more anterior, and the head is proportionally larger than the rest of the body, making airway maintenance more difficult. Given that the airway structures are smaller than in an adult, obstructions occur with greater ease. This includes foreign bodies, as well as airway restriction or obstruction due to mucus or inflammation. Airway management considerations and techniques for pediatrics will be discussed in greater depth in a different course module. Now that we are familiar with the components of the respiratory system, it is time to identify the system's functions. To a layperson, the respiratory system is responsible for breathing. For an EMT, however, the respiratory system is much more complicated than that. The respiratory system makes both ventilation and respiration possible. While these terms are sometimes used interchangeably, doing so is actually incorrect, as they mean two very different things. Ventilation is the mechanical process of moving air into and out of the lungs. Picture a balloon inflating and deflating. That movement of air into and out of the balloon is ventilation. Just moving air into and out of the lungs is not enough, however. Somehow we need the oxygen in that air to enter our bloodstream. We then need that oxygen in the bloodstream to enter individual cells. As a part of doing work, our cells produce waste products such as carbon dioxide. That carbon dioxide needs to leave the cells, enter the bloodstream, and then somehow be expelled from the body in the air we exhale. The process by which oxygen and carbon dioxide pass between the bloodstream and cells is called respiration, or cellular respiration. Within the lungs themselves, oxygen and carbon dioxide move between the alveoli and the bloodstream by a process known as diffusion. For additional reference, perfusion will also be mentioned throughout this course. Perfusion is defined as a circulation of blood through the capillaries, which is where respiration occurs. Without perfusion, there can be no diffusion or respiration. As a result, the moving of gases, nutrients, and waste products through the capillaries to and from the cells of the body is sometimes called perfusion instead of respiration, depending on the textbook author. There are texts that are even more specific in their definition of perfusion, using the word to describe the passing of oxygen from the capillaries into the cells, without any mention to the need for carbon dioxide to also pass from the cells back into the capillaries. When discussing shock later in this course, the ability of the body to deliver oxygen to its cells is referred to as perfusion, or the ability to perfuse. The difference between ventilation and respiration is important to understand, as a patient may be ventilating adequately, but due to some ailment is unable to respirate or perfuse. Inversely, compression-only CPR works because of respiration, not ventilation. Moving air in and out of the lungs is not as important as circulating the oxygen already existing within the body so that the process of cellular respiration can occur. Obviously, without some ventilation, some fresh oxygen in the lungs, respiration will eventually cease even if adequate compressions are being performed, as there is no oxygen left in the blood to supply the cells. As a result, maintaining an adequate airway and ventilating a patient is an important part of performing CPR. Hopefully this example illustrates the difference between ventilation and respiration. Another function of the respiratory system deals with something called the acid-base balance within our bodies. Our cells are constantly producing hydrogen ions, which become acids within the body. Too much or too little acid within the body is a bad thing. So the body regulates its acid-base balance through several mechanisms, one of which is through the respiratory system. Carbon dioxide is a byproduct of cellular metabolism, and we expel carbon dioxide from our body by exhaling. Carbon dioxide is also acidic. As a result, an increase in respiratory rate results in more carbon dioxide being expelled, making the body more alkaline. A decrease in respiratory rate, on the other hand, retains carbon dioxide, making the body more acidic. This process works in conjunction with something called the buffer or bicarbonate buffer system and the kidneys to regulate our body's acid-base balance, and is yet another important function